Psychedelic assisted therapy is gaining attention in the therapeutic community, and this raises several questions. What exactly is it? Is it merely a profit-driven venture for pharmaceutical companies? For therapists who want to gain familiarity with the history of psychedelic medicine, how can we deepen our understanding? Furthermore, how can therapists committed to a decolonized perspective integrate this approach into their practice? And what does this entail? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sun. As part of our AAPI Heritage Series, we have the pleasure to be joined by Hoor Jangda, a licensed master clinical social worker working as a trauma therapist, seeing clients both in Austin, Texas and Washington, D.C. Hoor has a master's in global policy studies, which led her to a decade-long career as a federal consultant, driving large-scale system change in the DC area, with the goal of wanting to work directly with those impacted by oppressive systems. Hoor got her MSW at the University of Denver. Hoor's clinical focus includes working with adult survivors of trauma who want to move beyond survival mode and build a more integrated sense of self. As an immigrant to the United States, Hoor draws from her own journey of healing from generational traumas to bring a holistic approach that integrates knowledge from neuroscience, epigenetics, body movement, and psychotherapy. Hoor has a special interest in working with immigrant and the LGBTQIA+ populations, and broadly those in marginalized bodies struggling in their professional and personal environments, which can often manifest as depression, anxiety, lack of identity cohesion, and grief. Hoor is a member of the Muslim Association for Psychological Services, is trained in EMDR, has completed the Psychedelic Liberation Training, and is currently undergoing training for psychedelic assisted therapy. As a South Asian Pakistani therapist, Hoor will be discussing a decolonized approach to psychedelic assisted therapy, highlighting what values and practices we as individual practitioners and the field of mental health overall need to consider to ensure an inclusive approach as we embark on this new phase in Western psychology. Hoor, thank you so much for joining me and willing to speak with me on this podcast.
Yeah, thank you so much for having me, Jack. I'm really excited to chat with you and to dive into this topic.
You've had an interesting career before getting into social work.
Yes, indeed,
Yeah.
indeed.
Yeah.
It's been a winding road.
Wow. Did that career help shape your perspective in doing social work?
Absolutely. Having a policy perspective and working on large system change as a federal consultant allowed me to have a very macro lens on social issues, which is something that I bring very strongly into not just my clinical work, but also how I'm looking at the field overall that is evolving and shifting, and being mindful of what considerations we do need to make as we're making this shift in the field of mental health.
Yeah. So you're really seeing the field as a whole and your individual impact in this system, in this field. And then you decided to get into psychedelic assisted therapy. You're pursuing this training. So for the sake of our listeners, we're going to be talking about values and practices. And you're speaking to the decolonized approach to doing this treatment. So first of all, what does that mean to you?
Right. Great way to start. Definitely let's get the framework agreed upon. So I think from my lens, it's integral that we acknowledge that while this is a newer phase in Western psychology, Indigenous populations have used plant medicine for centuries, if not millennia. And a lot of what we're doing in some sense is borrowing from that knowledge and taking what we are learning even from the compounds of the plant medicine to create newer medicines such as ketamine, which is now more widely accessible across the country. So the decolonized approach starts with, one, ensuring that we acknowledge the colonial history of this land and the people from whom we are taking this medicine and integrating it into our practices? And how can we ensure we honor the original patrons of these medicines and bring them and or their practices into our knowledge sphere?
So there's an acknowledgement piece. I want to throw a curveball, if I may,
Let's
because
do it.
because you have a systems approach. So I'm actually
Mhm.
curious from this, and you've worked in large healthcare systems. So within the line of like giving homage to the ancestors who created or used this plant medicine, as we know, many of the psychedelics now are only available in terms of manufactured by certain facilities. Thus, actually, there's an intersection of like capitalism, how that's propagated
Mhm.
in terms of producing the plant medicine. So how do we, we can acknowledge it. Does it stop there in terms of the colonialized approach? Like, how do we take this further?
Great way to think about it, right? Which is the acknowledgement is the baseline, and that's where we build from. It starts with acknowledgement and ensuring that our practices and the way that we are structuring our organizational or even broader social policy or mental health policies as a state or as a nation accounts for the decolonized approach or an anti-oppression lens, meaning that we acknowledge that white supremacy and capitalism values are already part of our existing systems. And knowing that they are part of these systems, how can we account for that as we are shifting and taking shape in this newer phase of mental health? So it starts with an acknowledgement, but ensures that as we're designing newer policies, as we're designing new practices into our organizational structures, that we are cognizant of how pervasive white supremacist and capitalist values are in our existing practices, and to ensure that we're not perpetuating those as we're designing newer treatments and newer ways of making space and finding a resolution for people's trauma and pain.
Okay, thank you for that, because you're speaking to the fact that this field is new from the Western perspective, but it's been practiced from an indigenous perspective. We are borrowing this practice and trying to Westernize it. So we have influence, is what you're conveying here.
We have influence and we have immense power, and that part is not lost because we are borrowing from populations that are either have been intentionally marginalized or currently lack power in the way that we understand our legal and socioeconomic structure today. So ensuring that we account for the ways in which the way that these groups have been marginalized, and ensuring that we do not perpetuate that marginalization in the groups that we work with and the groups that we treat, but also in the ways in which the original patrons of these medicines are integrated into the research and the policy design and the treatment models.
Okay. Thanks for that tip. So we talked about the values. Share with me, because you mentioned we do have influence, we do have power, because we the dynamic of a therapist and client. There's the power dynamics, as well as those who are learning and getting certification in this therapy. Can you share with us other examples how you have infused decolonial approaches or values to how you are even learning or implementing this practice?
Yeah. So I will start with saying that it started with me as an individual before it permeated into practices and before it permeated into an understanding of the system overall, meaning that I had to unlearn white supremacy and colonial values as they existed within my ethos, my body, my values, and how I showed up in the world. There was a lot of unlearning that I had to do to ensure that as I was approaching this field and shifts in the field, that I was not bringing those biases and those worldviews into this newer phase that we are entering in as far as the mental health field is concerned. So I would start with that in terms of anyone that is interested in wanting to pursue this career is identifying how white supremacy and capitalist values are showing up in your own body and in your own ethos today, and approaching that with compassion, so that there is an ability to have that grace with yourself as you are unlearning all the ways in which we have internalized all these values, and moving from there and thinking about the communities that we do want to serve, and where we want to take this medicine in the future, knowing that yes, in its synthetic form, it can exist potentially in abundance, but in its plant form and in the original form, it is existing in limited numbers. So what does that mean, even from an environmental perspective, as to how we are integrating something that is in limited quantity, but the need for it is so pervasive and wide? And that's why it's integral to acknowledge that psychedelics, like everything else, is an approach and it's a tool. It's not the final answer. What we need is broader social change that is creating the need for something as intense as psychedelics to work with people's trauma. There's a reason that the trauma is there in the first place. And how is our environment contributing to the traumas that individuals are experiencing in their bodies? So yes, psychedelics can provide this absolutely beautiful way of opening your mind and coming to terms with all the ways in which your body has been impacted by your traumatic experiences, but you're still going back out into the world. And if the world has stayed the same, then
you're going to be re-traumatized. It's insufficient.
It is insufficient.
Yeah.
That is a great way of putting it.
Yeah. So why don't you continue with telling me a little bit more about, what does practice look like with this model?
Yeah. So I think that what often comes up when it comes to psychedelic assisted therapy, which does apply a little bit in just a general therapeutic environment as well, which is the concept of set and setting, right? Which is the mindset within which me as a clinician is coming in, and the mindset with which the individual that is receiving the medicine is coming in, and ensuring that there is a clear understanding of what is it that the individual is trying to get out of that, and how can I as a practitioner facilitate that goal or that journey, and ensuring that the setting within which this is happening is a setting in which the client feels safe to explore their goals, to dive deeper into the parts of them that have remained unacknowledged or repressed or intentionally silenced by either their individual environment or the environments within which they exist in as a broader society because of whatever identities they occupy. So the set and setting is very integral to ensuring that whatever we are trying to achieve has a very solid container within which we can hold this path. And the more we can add to that, whether it's music, lighting, just comfortable place to sit on, a blanket, anything that gives you that cozy feel of like, okay, I can let go. My body feels safe to let go. And I can dive into these very painful parts of me and still feel safe and held throughout that journey. And that part is very integral to the psychedelic therapy experience. And what's also important in line with that is the integration that happens after the journey. Because from a neuroscience perspective, that's where the magic is happening. Our brain is open, neuroplasticity is high. Our ability to make change and be receptive to new information is at an all-time high. And that is where, as a therapist, I want to be. Because this is where we can start to really get into the depths of the trauma or the depression or the substance use, whatever it is that the individual is wanting to work on. That is the window that we really have to dive deep. So as a starting point, this is kind of what I would say.
Okay. And it makes sense because if the therapist is unwilling to explore some of the reasons for why patients are, say, coming in for depression, and come to discover that the depression has, I guess, that there are discriminatory practices that the patient has experienced, and And if we're unwilling to explore that with them, then that's a missed opportunity. And it also doesn't convey to the patient that you feel comfortable talking about it. And so they don't feel safe. So they're going to close up. I also like the explanation of set and setting. And then, it does make me think about the office arrangement. It's just a basic physical office arrangement, how that has, depending if you're psychodynamic perspective or, certain other perspective, there's certain ways in which the office setting is designed. But it does make you think more intentionally about how you create that physical environment.
Absolutely. The physical environment plays a huge role. And even in terms of, as you were saying, that what are some of the ways that I as a clinician can ensure that the client is feeling safe, that comes quite a bit in the prep session before we even start the journey. And there are questions around the power dynamic that exists, which is what are things about my identity, my personhood, my presence here that is impacting you in any way, and what can I shift? What would you like to know about me and this relationship that would be critical for your journey? So bringing in that relational dynamic, calling out the power dynamic and laying it all out on the table allows the client the opportunity, whether they want to pick it up and talk about it or it's not a consideration for them. But the more we can create an intentional space for them to talk about what are often difficult subjects or things that are unsaid in a therapeutic relationship, ensures that there is a level of comfort to be almost equally open in either the conversation or in the journey.
It actually makes a therapeutic relationship even more important because you're trying to accelerate that early on. Since some of these ketamine infusion clinics, you have say like 6 infusions. You're trying to develop a relationship that quickly. So we know that psychedelic assisted therapy in terms of the field is predominantly white. When you mentioned this decolonizing approach, such as being able to ask, hey, what is it like for you to do this type of treatment with me? Does what I look, what would you like to know about me? I'm curious, actually, from your perspective, do you hear this, maybe by me asking this question points to maybe some assumptions I have about white therapists in general. Do you see this being brought up with therapists who are white, who are saying, hey, I need to ask my clients who may be Black, brown, what is it like doing this treatment with me as a white therapist?
Yeah, that's a great question. And I think it depends on the protocol that either the agency is following and or where they received their training and what training they have received. There are many different models that people adopt when it comes to psychedelic assisted therapy. There is the alignment to the indigenous models where there is a more spiritual lens to the approach. There's a medical model that approaches it very much from like a psychodynamic or psychotherapy lens. And so they all have their own protocols and their own ways in which they approach things. In the training that I have received and the prep protocols that we've received, there were explicit questions around power dynamics and ensuring that we were building that rapport and acknowledging any ways in which the client was feeling that they could not show up as themselves and what was getting in their way.
Oh, wow. Thank you for also clarifying that there's different protocols out there. And specifically for the one that you're trained in does explicitly ask about these power dynamics and being mindful and aware of also potentially the racial differences.
Right.
Yeah. Wow. Okay.
And I want to clarify that it's not just the racial differences. It can be a gender difference. It can be an ability difference. It can be a difference of faith and value systems. And the most fundamental power dynamic is the power dynamic between the therapist and the client, which regardless of my race is always there.
Yeah. So those are clear examples of the practice. Now, is there anything else you want to share with our listeners around this area of psychedelic assisted therapy and coming at it from a decolonial lens?
Yeah, the final point that I would make is specifically around the accessibility of the care itself, especially when we're talking about it from a decolonial lens, thinking about what is the population or who is in the population that really needs it the most, and who currently has the resources to access what is a pretty expensive treatment or a pretty expensive approach. So thinking about ways in which we can make the therapy and the therapeutic models accessible. And there are different ways that people are finding where they can integrate insurance for the prep and integration sessions with our just the therapy sessions, and then out-of-pocket pay for just the journey itself, which is not currently covered by insurance. So just finding creative ways in which you can still ensure that it's accessible to a wider range of the population ensures that we're still continuing to challenge the capitalist models that are currently very pervasive, especially as, we talked about infusion clinics and how they are becoming more widespread in our communities.
It is making me have a thought, which is, if you're doing the infusion, again, I've never gone through the training myself. I've thought about it, so I don't know what it actually looks like. So I'm just assuming that, you go through the infusion and you wait a little bit, but you're still speaking and interacting with a therapist. How can that time not be billable?
So in terms of speaking while you are under the medicine,
Yes.
It varies by the individual and the medicine itself. What is most pervasive today, which is ketamine, most people don't talk. The impact of the medicine, the way that it shows up on us, most people are having a much more inward journey compared to, let's say, something like MDMA, which from a research perspective, we know allows for greater conversation and greater dialogue. So the part that is currently not covered under the insurance is the actual medicine itself and the intake and the ingestion of the medicine itself. And so from my understanding, that's the reason that that session could not be covered by insurance, because the person is under the influence during that time.
Got it. Yeah. Because again, this maybe conveys sort of just my novice knowledge. And I remember early on when it was MDMA, it was advocated, they're more open, more talkative, they're more willing to explore. So I'm thinking, wait, you need a bill for that. But anyways, it just shows my lack of knowledge in terms of the ketamine infusion, where nowadays they're not actually doing much conversing.
And I also want to clarify that there are infusion clinics that have no therapy attached to it. There's no prep and there's no integration. And as a provider, it's integral for me to educate clients that are interested in it, whether it's with me or anywhere else, that however they choose to approach it and wherever they choose to approach it, that the integration and the therapy part is extremely critical, not just from a neuroscience perspective, but also what the research is telling us is most effective in treating some of the things that we are trying to address, such as PTSD and depression, anxiety, et cetera.
Oh, wow. That's so informative. Again, letting even folks like myself, because I have clients that are asking about this nowadays. And I just didn't know there was such variability, and even within the infusion clinics.
Yeah, there's variability in the infusion clinics. There's variability in a lot of the mail order ketamine, just medication that you can ingest at home that is not an IM shot. So there, as we talked about, capitalism is pervasive. People are taking advantage of what is in the media talked about as this radical and beautiful solution, which it is from a research perspective. And we've seen it with clients, the shifts that we're seeing in people's depressive symptoms, people's traumatic symptoms, people's anxiety symptoms. But we have to at least stay true to what the research is telling us, which is that without the integration, ends up perpetuating the harm that we are trying to resolve in the first place.
Wow. Well, thanks for this just phenomenal insight. So, you again, I mentioned your introduction. You've made this career shift into social work. Can you share with us any memorable events or circumstances that influenced how you got to doing this work?
Yeah, I mean, if there was one clear event that shifted things, I would gladly share it. I would say it was more of an evolution that led me here. And the evolution was a result of my privilege with having access to something like therapy and body movement in the practice of yoga, or body work in the practice of just massages on my physical body and releasing the trauma from my body. And having the resources and access to that allowed me to really confront how disconnected I was from my body because of my personal traumas, because of generational traumas that I carried with me. And the benefit that I received with rebuilding that bridge and starting to listen to my body and feel comfortable giving her what she needed, which also was a practice that I had to come into. So the journey of self-discovery, there was just this moment where I arrived of pretty much just euphoria is the best way I can describe it. And it was this feeling of, I just want to tell everybody that, do you know that you can feel this almost like anchored peace within you that even in my most depressive states, I can access. I know that my core is at peace. And that is a result of all the work that I had access to and that I was able to do. And there was this inner pull that compelled me and said, oh, you have this, you have to share it with the world. People need to know what it feels like to not carry the weight of not just the individual trauma, but the generations of trauma and how they shaped and stayed in my body and what it feels like to release it and have it just be out in the ethers. So it really came from this place of like, I just want to shout from the rooftops.
Yeah, the place of joy, excitement,
the place
liberation.
of joy.
Yeah.
Exactly. Yeah, liberation is the right word. It felt liberating in literal and metaphorical sense.
Wow. Okay. And so thinking about this journey that you've taken, because it's a long journey, career shift, right? Oh gosh, going back to school, oh man, and then doing these certifications.
Writing papers in my late 30s was a fun experiment.
Oh, wow. As a woman of color, what were some challenges you faced that you overcame and you'd be willing to share with us?
Yeah, that's definitely a tough one because I think I'm always confronting that part of me and having to move past it. But I will start by saying that the concept of race or even being a person of color is not something I had to confront until I immigrated to the United States in terms of just trying to understand, oh, I have a race. What does it mean? What box does that put me in? And how do I come out of that box? So even just confronting that reality was very hard. And then moving into the consulting world and then eventually the world of social work and mental health, I was often put in the position where I was the only person of color in the room and oftentimes expected to represent populations that I was not a part of, but expected to know about other marginalized groups because nobody else was talking about them. So there was this immense sense of responsibility that I felt to educate myself, not just about my own identity, my own race, but about the broader community and realizing, as we all eventually do, that all of our struggles are interconnected. So it benefits me to know more about, as much as I can, about marginalized groups and their experiences and what needs to be said in certain rooms, how it needs to be said, how it will be heard. Will it be received better for me versus, let's say, someone of a different identity that is experiencing greater marginalization compared to myself?
So having gone through that, the pressure that many, folks look to you, say, hey, you're a woman of color, so somehow you speak all people of color. So that's a huge undertaking. And so how did you overcome that?
I'm not sure I did, very honestly. I think it's a constant internal battle because there are days when I feel compelled to speak up and I do. And there are days when I feel like I'm occupying space that is not mine, or that it's not an experience that I have an authority to speak on. But in the absence of anyone speaking on it, it's my responsibility to do so, and I do. So in terms of overcoming it, what it really looks like is day-to-day, minute-by-minute experience, essentially evaluating how safe is it for me to vocalize different perspectives in this room. And how can I do it in a manner that it will be heard by the other person, and try as much to limit my own internal frustration, anger, not just of the systems with which I'm interacting, but just the fact that this labor needs to happen at all.
Yeah. Thanks for speaking about that. I really wish that more people step up, not just people of color. I think,
Mm-hmm.
white is also a color. So I do think in
Mm-hmm.
general, people just need to speak up more so it doesn't default to person of color. So for you, what does it mean to be a South Asian Pakistani therapist?
I think it means that I always have a very deep and long lineage that resides within me that I always have access to. Learning about my cultural and ancestral heritage was a huge gift, something that's not available to a lot of South Asian people. A lot of that ancestral knowledge, a lot of just knowledge in general was lost. And so for me, it's a lot about pride and reclaiming and remembering that pride and ensuring that that's how I show up in all spaces, including the therapeutic space.
When you said you had access to heritage in your culture, what do you mean by that?
Yeah, so I think that for me personally, growing up, I was extremely curious about where I come from, who are the people I come from. My ethnic community does not have a written language. So in terms of knowledge, it's all just oral, learning from family members. And for most of my life, there was an immense resistance to talk about the partition of the subcontinent. Understandably so. It was extremely traumatic, very painful. Nobody wants to remember that. And so that resistance meant that there was a large amount of knowledge about who my people were that I just never had. And so starting with just baseline research of just what existed on the internet, what exists in books is where I started. And then I brought that back into conversations with my grandmother, who very generously sat with me for hours as I recorded her and just asked her, who are our family members? Tell me about them. I don't need to know anything specific, but I just need to know, what kind of people were they? What did they like to do? What was your relationship like with them? What did you know about their personalities? And getting to hear as much as my grandmother could remember. And she has, thankfully, an extremely sharp memory till this day. And she would just sit there knitting her scarf and sharing things with me. And I would be just taking notes and recording her so that, if nothing else, I at least know about that part of my family and learn just their little quirks, which for me was way more exciting than broader, big history.
Wow, that's so beautiful. Thank you for sharing that.
Yeah, of course.
And Hoor, how can we support you?
I think just continuing to talk about these topics and ensuring that people are continuing to learn and unlearn all the ways in which they were told that they were not enough, or that there is something within them that's missing, whereas all of the answers that we really need reside within us, and it's really just the systems around us that have silenced or cut off those parts of us. And the more we can connect with our bodies and our spirit and our mind is where those true answers and that magic really happen. So in terms of support, I just share the knowledge is really kind of fundamental to what I believe. And the more people that know, the more we can have a community of people that are loudly talking about these things and ensuring that there is a collective rather than an individual person that is trying to amplify their voice. We're louder in numbers.
Yeah. Within the framework of sharing knowledge, that's exactly what we're here to do. And thank you so much for instilling that knowledge, for myself, even as well as our listeners, pointing out that there's these different protocols, and particularly reinforcing just how important and how critical it is the therapeutic relationship plays a role in psychedelic assisted therapy. And because I think many therapists, again, like myself, don't know, I didn't know that this was a crucial part of it, because the way it's being advertised or discussed oftentimes as just the infusion rather
Correct.
than the integration. So thank you so much for sharing all this with us.
Thank you for having me. And I think we just continue our journey of unlearning and learning. And I'm excited for what's ahead. There's lots of changes that are happening in the field and lots of policies and research that is underway. I'm excited for what's to come, and I'm very optimistic.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.